Welcome to The Heart of Health Live. There's a place for modern medicine in your life. Learn to use it correctly by getting your toughest questions answered on today's broadcast. Discover modern medicine's strengths and weaknesses. Lifestyle medicine opens the door to optimum health and healing. How you live and what you eat can profoundly affect mind and body. Learn simple solutions to complex problems. God provides the ultimate healing we all desire. He wants us healthy and happy. We just need to understand His plan for our lives and live accordingly. And now, live from Studio 1A in Chattanooga, Tennessee, here's your Heart of Health host, Dr. James Marcum.
The Heart of Health Live. I'm Dr. James Marcum, and I'm so glad you join us. We have an excellent program for tonight. Today we have Russell Atkins, a physical therapist that has actually been practicing quite a few years. He knows what he's talking about. Some interesting things. I want you to realize that physical therapists, a lot of people don't even know what physical therapists do. In fact, many physicians even have knowledge of what a physical therapy evaluation is all about. Also, many doctors as well as lay professionals don't know the modalities that physical therapists use. That's the things they use. They actually use their hands, they actually use other instruments to work on people to make them feel better. So I want you to know perhaps more than doctors or other providers. And I made a long list of all the different situations that a physical therapist might help. Listen to this list. If you've ever had a sports injury, if you've ever had chronic disease such as arthritis or lupus, if you have a surgery condition where you need to get your muscles stronger before or after surgery, if you've ever had chronic fatigue and pain, if you've ever had problems with balance or motility, if you've had a sports or muscle injury, if you've had lower back pain, which many of us always have, if you've ever had problems with your bowels or bladder, now I didn't even know that one. If you've had problems with your bowel or bladder, that's a big deal. If you've ever had a stroke or needing rehab for neurological problems, this might be a program for you. So I want you to stay tuned tonight, and remember, at Heart of Health Live, we let people know that there's a place for modern medicine, but it doesn't fix everything. There's also a place for lifestyle, and we're going to talk a lot about lifestyle. But it's in that relationship with the Heavenly Father that things are really brought together. And in that relationship with Him, He teaches us truth. He teaches us things about changing our lifestyle, so hopefully we don't need modern medicine. We don't need all these things. So those are some interesting things we're going to learn tonight. One other interesting conclusion, I was looking on the internet today in the North American Journal of Sports and Physical Therapies. They did a study. They did a study about what type of people get to a physical therapist. So we're going to talk about this because a lot of you out there don't even know what a physical therapist does. Sometimes I don't even know, and sometimes I need help and I just want to know who to go to, and I go to the wrong person, I get mad, they send me to someone else. Well, this article said, and this was written a few years ago, back in 2006, this says that 1/3, 1 in 3 of referrals to physical therapists have no medical diagnosis at all. So they're going to the physical therapist, they don't even know, the physical therapist don't even know why they're there. The other 2/3 are sent there for this diagnosis of pain and treatment. Well, we want to increase your knowledge today, so stay with us. We're going to be back with Russell Atkins, physical therapist, right after this short break.
The Heart of Health Live will return in just a moment.
I'm Dr. James Marcum, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org.
Have you ever heard things about God that didn't make sense? Have you ever thought that science and Scripture cannot be reconciled? Have you heard ideas about God that scare you? Or are you just tired and confused? If you want answers to complex problems, if you want a testable, evidence-based understanding of God and the world around you, an understanding in which the Bible and science harmonize to reveal the reality that God is love all the time, then Come and Reason Ministries is for you. Hi, I'm Dr. Tim Jennings, board-certified psychiatrist, and Come and Reason Ministries is dedicated to helping you learn to discern, to stimulate you to think, to help hone and refine your ability to know the right from the wrong, the healthy from the unhealthy, and teach you how to experience healing of your mind, body, and relationships here and now. If you would like an evidence-based approach to knowing God, then visit us online at comeandreason.com.
Hello, I'm Joe Coaches. If you enjoy Heartwise Ministry as much as I do, you just might want to become involved. We would first really appreciate your prayer that God would continue to bless and lead this unique ministry. Also, it is very important that you think about becoming a financial partner, supporting us so that we can take this message throughout the world to everyone. Thank you.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
I'm glad you stayed with us. Some of you probably had to go to the bathroom. Some of you probably had to get a snack. But I'm glad you stayed because we're going to learn something today. We're going to learn something very interesting. And if you want to be a part of our program, let me give you out our toll-free number. That's 855-644-3278. We want you to be a part of our program tonight. First, I want to welcome Russell. Russell's been on our radio program. Russell, we're glad you're here tonight.
It's a pleasure to be here.
Now, as we get started, just tell us a little bit about your story. What brought you to your profession and what do you do every day? Just give us an overview of how you decided to be a physical therapist. Well, why do you keep going to work?
It was kind of a happy accident. I was a little undecided on what I wanted to do coming into college. I knew I enjoyed sciences and wanted to do something in healthcare, but I didn't have a real good focus. Started a nursing program, decided that wasn't for me, and then my mother happened to cut an article out of the newspaper that projected job availability over the next 20 years, and this was back in the early 80s, and physical therapy was number 3 on the list. And all I cared was that wasn't nursing. That was the only thing that mattered to me. So I committed to the program and got the grades and went out west to school, and as they say, the rest is history. What keeps me coming into work is the understanding and the knowledge base that I have that I can take a patient that comes into my office with significant dysfunction in their neuromusculoskeletal system, and I can make some changes in the clinic. I can have the patient follow up with some stretches and strengthening exercises at home, and I can restore them to normal function and make a dramatic change in the way that they are now able to live their life.
Now, I understand that when you first started out, you worked with some athletes for a while?
Correct. My first 10 years of practice was in San Diego, and I worked at a sports medicine center where we saw the San Diego Padres baseball players. So I saw a lot of professional athletes, mainly baseball, some football and volleyball and soccer, and a lot of triathletes out there too. But 10 years ago, I decided to move back to the South and open my own practice, and I've never been happier professionally.
Now, do you have different age groups now? I know it sounded like you had a more younger group there.
I did. In my clinic in Ottawa, I've seen patients as young as 9 and patients as old as 90. So it's a fairly wide range, fairly equally dispersed male and female as well.
Now, how long of schooling did you have to go to? I mean, is it just 6 months or a couple months?
No. Well, when I went to school back in the dark ages, we came out with a bachelor degree in physical therapy. Now it's a doctorate level degree, which is 6 years out of college.
Okay. Now, would it be fair to say, I don't know about you, but I'm a practicing cardiologist, and I have actually learned a lot more since I've been out practicing than they actually taught me. Was that fair with physical therapy too?
Oh, absolutely. Physical therapy school, and I would well imagine med school as well, gives you a good foundation to build on.
Right.
It teaches you how to study, teaches you how to investigate, and gives you that foundation and scaffolding on which to build on. By far, the greater balance of my education has occurred through continuing education and putting that into practice and experience.
And what I've also learned is that what they teach you in school is not always totally correct, and that there's other ways that you can have healing that's unbelievable. And that's why I try to put, the creation, how God wanted us to be as part of this. And I'm sure that in physical therapy, you can do that as well.
Oh, absolutely. The engineering of the human body, just with the 3 or 4 systems that I am considered expert in is astonishing. And your expertise in the vascular system, I'm sure you see it every day. And to eliminate that background of an intelligent designer and a loving creator is to handicap yourself as a clinician.
And one of the things that I appreciate about certain physical therapists, I know I had one that worked with my shoulder once, and they touched me.
Yes.
And there's a certain physical healing in the mind, I think, that comes from just touch.
Oh, I agree. There's not only that, there's a lot of information that a skilled clinician can glean from touching a patient. You can read tension, you can read position, you can read something we know as end feel. That's the way a joint feels at the end of its available range. And that gives you a lot of information, and it directs your treatment.
Okay, well that's great. Well, we want your questions, so go to our website. That's 555-644-3278. If you have any questions or concerns or want to learn more after this break, we're going to go to some questions that come onto our website. Russell, where's your practice? What's the name of your practice in case someone locally might want to get a hold of you?
It's 101 Physical Therapy. The numeral is 101 Physical Therapy. It's located in Ooltewah, Tennessee.
101 Physical. Well, we're going to be right back after this break. Stay with us, sit up straight, because we're going to talk about physical therapy. We'll be right back.
The Heart of Health Live will return in just a moment.
You can easily spend $90 on an expensive meal out. How about investing $89.94 in your future? Just think about the possibility of coming off those prescription pills and getting rid of all the side effects. Think about feeling better than you have ever felt in your life. This is all possible for you. For only $89.94, you will receive a 7-part DVD series, Weight Management by the Book, a 30-lesson workbook with over 100 recipes, and if ordered today, exercise tubes will be included for free to help with your journey. There are many programs available, but this unique program has identified the truth about how to manage weight. This program is not available in stores. This limited offer will not last long. Pick up the phone now and dial 877-504-9628. Operators are standing by. This call will change your life forever.
So here's a question. If you love Jesus, and I mean truly love him, people will notice, right? I mean, if Jesus is at the center of everything you do, people will have to notice. And that is exactly what Life Talk is all about. You see, at Life Talk, our goal has always been to connect people to the true source of power, Jesus Christ. We know with Jesus at the center of our lives, nothing is impossible.
There's a place for modern medicine, but that's not enough. There's a place for lifestyle, but that's not enough. The real truth in medicine, the real truth in healing comes from that relationship with the Heavenly Father. That relationship can show us the balance, when to use modern medicine, when to use lifestyle, and to use it for the right reasons. Well, this book gives the solution to the healthcare dilemma. It answers the question, why am I sick? How do I get better? And how can I have ultimate healing?
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back. We're glad you're with us. We're here with physical therapist Russell Atkins. He has a practice in Ottawa, Tennessee. And you know, friends, we're all healers out there. And if you want to be a healer tonight, if you're sitting next to one, make them laugh, touch them, make them feel good. When you do this, you help serve them, you increase your endorphins. So we want to increase your endorphins. A lot of medical programs are real serious, but we want you to laugh and be happy and have your questions answered. 855-644-3278. And we have a question here that has come in from our website. And we want to start the day off by answering this question. It says, why do people go to a physical therapist? Now that's a very broad question, but we'll just sort of give out a broad answer.
Well, the number one reason is because their physician referred them.
Okay.
And earlier you mentioned that a lot of physicians don't know, that they don't write a diagnosis down, or they just write your pain, evaluate, and treat, you kind of just to get the patient out of their hair. Some patients are becoming more educated with the internet, with the availability of information. They're searching things. They just said, you know, my shoulder, my back hurts. What do I do? And they'll Google shoulder pain or back pain, and you know, the top 5
come up.
Searches come up. The one, you know, physical therapy would be one. I'll investigate physical therapy for my whatever.
Okay. Now, when someone comes into you, so a lot of times you have to figure out whether it's an appropriate patient?
Correct. I'm always amused when I get a diagnosis that says low back pain. Low back pain is technically a symptom. Mm-hmm. There are probably 200 diagnoses of which low back pain is a symptom. Everything from a kidney stone to a spinal cord tumor to a muscle strain. And there may only be 10% of those 200 that are therapy appropriate.
Right.
So I like to believe that the physician has ruled out a spinal cord tumor before I start treating them.
But if you're like me, you never assume.
Correct.
Yeah.
So I do a fairly deeply investigative exam. It lasts for an hour. And it's getting rare now that a practitioner will spend a full hour with a patient.
Yeah, that's a long time.
You know, I have heard stories of orthopedic surgeons not even crossing the threshold of the doorway to come into a room. They'll stand outside the room, look at an x-ray box, tell the patient what they think's wrong with them, and move on to the next one. You know, they'll get 90 seconds of someone's time. So I think that first hour that I spend with the patient is by far the most valuable hour that I get.
Now, if I came in with, let's say, a diagnosis of low back pain, what would that hour include?
I would examine everything from your neck to your big toe.
Okay.
Because it's all connected and it's all related.
Okay.
You know, stiffness in the thoracic spine can put stress on the joints of the lumbar spine. Stiffness at the big toe joint can cause a gait problem where you don't advance forward, and that puts stress at the low back.
Okay.
Hip restrictions cause it. Weakness around the pelvic girdle can contribute to pain in the lumbar spine. So there's a whole chain that has to be examined.
Okay, and I guess you're probably thrilled if someone comes to you, you know, if you have a diagnosis, listen, I want you to help them exercise so they can improve. We talked about bowel incontinence problem, the pelvic girdle. You're probably thrilled to death when you have a diagnosis of that.
Well,
because it gives you specifically.
It does. It's that's an unusual diagnosis, and it's not part of my practice specialty. But there are therapists who specialize only in stress incontinence, and especially, particularly for women. And you know, strengthening the floor muscles of the pelvic girdle can get you a real bang for your buck in being able to control bladder incontinence.
Now, what's the number one symptom, would you say, that people come to you for?
Oh, no question. Pain, the top of the list.
Okay.
Now, I've never had a patient come in to me and say, I've got one leg 5 millimeters longer, my left hip is not extending adequately, my rotators on the other side are weak, and my SI joint is sheared. Okay, that's up to me to determine that. And in that exam process, I have to go through and, based on my understanding of what normal joint function is, I can identify abnormal joint function, and then I can link that to what's causing pain symptoms.
Okay.
The hard reality is the physical therapists don't have anything in their toolbox to directly address pain. We can't prescribe pain medicine. We can't do pain relieving injections. We can't do nerve blocks. That's physician's realm.
Yeah, but I'm going to counter with that. That just treats a symptom and doesn't get at a cause. So what am I really accomplishing?
Correct. Well, if a patient's pain symptoms are mechanical, for example, they're caused by some mechanical dysfunction, either a problem with the way they walk, a weakness in a muscle group, a restriction in joint capsule, a restriction in the connective tissue around between the muscles and fascia. You address those mechanics, you normalize the mechanics, and that takes the stress off of whatever tissue is being aggravated.
Well, I want you to save that thought,
Okay.
okay? Because it's time for us to go to break. Stay with us on Heart of Health Live. Give us a call, 855-644-3278. We're going to be right back. We're going to finish this thought in a moment.
The Heart of Health Live will return in just a moment.
I'm Dr. James Marcum, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org.
Have you ever heard things about God that didn't make sense? Have you ever thought that science and Scripture cannot be reconciled? Have you heard ideas about God that scare you? Or are you just tired and confused? If you want answers to complex problems, if you want a testable, evidence-based understanding of God and the world around you, an understanding in which the Bible and science harmonize to reveal the reality that God is love all the time, then Come and Reason Ministries is for you. Hi, I'm Dr. Tim Jennings, board-certified psychiatrist, and Come and Reason Ministries is dedicated to helping you learn to discern, to stimulate you to think, to help hone and refine your ability to know the right from the wrong, the healthy from the unhealthy, and teach you how to experience healing of your mind, body, and relationships here and now. If you would like an evidence-based approach to knowing God, then visit us online at comeandreason.com.
Hello, I'm Joe Coaches. If you enjoy Heartwise Ministry as much as I do, you just might want to become involved. We would first really appreciate your prayer that God would continue to bless and lead this unique ministry. Also, it is very important that you think about becoming a financial partner supporting us so that we can take this message throughout the world to everyone. Thank you.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back, and I hope everyone that's sitting out there is sitting up straight. We're talking with physical therapist Russell Atkins. He's an expert in all sorts of things, especially related to the structure and movement of the body. And last break we were talking, Russell, we were talking about pain and lower back pain, and I was remembering a patient I saw not too long ago that came to me eventually because he had a heart problem. But his heart problem started out was he was doing some heavy lifting, he hurt his back. And he didn't go to he saw somebody and they just put him on some medicine, some pain medicines. He took enough pain medicine so he could work. So he continued to work, got his back worse, never really addressed the problem. Before long he needed a spinal fusion. Had the spinal fusion, that did not go well. So he's again hooked on narcotics. Eventually it slowed down his system. He looked for all other coping mechanisms, including cigarettes. Now, this happened over 15 years. Sooner or later, he had his heart attack.
Right.
But you didn't help wonder, maybe we're treating symptoms rather than causes,
Absolutely. I think it's a huge problem in medicine in general, is the idea that we've become a quick fix nation. Doc, give me a pill to fix it. No, I don't want to quit smoking. I don't want to lose weight. I don't want to exercise. You just make it better.
Yeah.
I sadly get a lot of that in my office, where I'll identify a certain set of joint restrictions or issues, weaknesses, and I'll prescribe them a stretching and strengthening routine, and they don't want to do it.
Yeah.
They don't want to put the work in order to give the body its own God-giving healing capabilities and allow the tissues to heal. Normal tissue doesn't hurt.
Right. That's right.
It just doesn't.
So hurting means something's wrong.
Right, and I think that's God-given as well. Pain is our indication that something's not right.
Yeah. Now with that, I want to hold this. We have a call that's come in from Lori. Lori's calling us from Virginia. Lori, what's your call for Russell Atkins today? What's your question? You hear us, Lori? Lori, do you hear us? Okay, we're waiting for Lori from Virginia. I hope she had a question about physical therapy tonight. Sometimes we get callers that have different questions. Lori, can you hear us?
Yes, I can.
Did you have a question for Russell Atkins today?
Yes, I do, and thank you for taking my call. This is my question. I have two friends who both complain a fair amount, and they complain about the same thing, it's back pain. But one of them goes to a chiropractor, and one of them is seeing a physical therapist. Why is that?
How long do you have, Lori?
Okay.
There's a lot of carryover. There's a lot of crossover between what chiropractors do and what physical therapists do, and you're going to get different answers if you ask each practitioner who's better or who has the best approach. I have some of my patients who also see chiropractors, and I don't try to talk them out of seeing a practitioner they're happy with. I have some philosophical differences with chiropractic care, and I imagine they have some differences with physical therapy care as well. My question to you is, are they both getting better?
Well, they keep talking about it on and on, so I'm thinking that maybe they're not.
Yeah, well, that sounds like a good indication. You're going to get good and bad practitioners in any discipline, If a patient comes to see me and I'm not seeing a trend toward improvement in a month and a half, 6, maybe 8 weeks, it's time to cut our losses, and physical therapy is not going to be the answer. And that's one of the issues that I have with chiropractors. A lot of chiropractors will see a patient for 6, 8, 12 months, with little or no improvement in symptoms.
Did that answer your question, Lori?
Well, now with that information, I'll have something to ask them when I talk to them next.
And what are you going to ask them, Lori?
Well, I'm going to ask them if they're getting better. And if they're not, maybe they need to look elsewhere.
Exactly. I think you're dead correct, and I affirm you for being a good enough friend to investigate this further for them.
Okay. Well, Lori, thank you for calling us. We appreciate you taking your time tonight.
Thank you.
Okay. Thank you, Lori. Well, that's very interesting, about, there's so many overlaps between chiropractors, orthopedics, physical therapists,
massage therapy,
massage
athletic
therapy,
trainers,
and I can see how people get confused. And, sometimes the marketing wins.
You're absolutely right. You're dead correct.
Marketing wins, and whether the truth out there, marketing wins out, and whether it's truth or not doesn't matter. And that's a great point that you made. Anyone that's not getting better, that's not seeing if it doesn't make sense,
Yeah, don't take your car to a mechanic 9 times that doesn't get you better.
Well, no, I wouldn't go to a restaurant that served me bad food. I wouldn't keep coming back, and that's common sense. So if we don't leave you with anything tonight on Heart of Health Live, if you're not getting better, look somewhere else. Look somewhere else.
Well said.
Hey, we like Lori's call. Give us a call. We have some more questions from our website after this break. Our number is 844-644-3278. We're going to be right back talking to Russell Atkins about physical therapy after this break.
The Heart of Health Live will return in just a moment.
You can easily spend $90 on an expensive meal out. How about investing $89.94 in your future? Just think about the possibility of coming off those prescription pills and getting rid of all the side effects. Think about feeling better than you have ever felt in your life. This is all possible for you. For only $89.94, you will receive a 7-part DVD series, Weight Management by the Book, a 30-lesson workbook with over 100 recipes, and if ordered today, exercise tubes will be included for free to help with your journey. There are many programs available, but this unique program has identified the truth about how to manage weight. This program is not available in stores. This limited offer will not last long. Pick up the phone now and dial 877-504-9628. Operators are standing by. This call will change your life forever.
So here's a question. If you love Jesus, and I mean truly love him, people will notice, right? I mean, if Jesus is at the center of everything you do, people will have to notice. And that is exactly what Life Talk is all about. You see, at Life Talk, our goal has always been to connect people to the true source of power, Jesus Christ. We know with Jesus at the center of our lives, nothing is impossible.
There's a place for modern medicine, but that's not enough. There's a place for lifestyle, but that's not enough. The real truth in medicine, the real truth in healing comes from that relationship with the Heavenly Father. That relationship can show us the balance, when to use modern medicine, when to use lifestyle, and to use it for the right reasons. Well, this book gives the solution to the healthcare dilemma. It answers the question, why am I sick? How do I get better? And how can I have ultimate healing?
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
You've got questions, we've got answers, but I haven't been given the number out right tonight. It's 855-644-3278. That's where you can ask your question live, even if I can't give the number out and there's someone that might be getting calls tonight that's not too happy. But we're learning a lot about physical therapy tonight. Russell, I'm glad you came on with us tonight. We've got another question that's come in from a website, and this is very interesting to everybody. A lot of people go to physical therapists because they're having pain, but sometimes they go and they have more pain. And this next question deals with this. It says, is it true that physical therapy is painful?
Well, short answer, yes, it is true.
Okay.
Sometimes it is. Sometimes joints, sometimes scar tissue develops around joints. For example, if you fracture the bone in your arm up near the shoulder joint and your physician has you in a sling for 2 months, the ligaments around the shoulder joint are going to get tight, and scar tissue is going to grow around that bone because that's the way God heals it. But the ligaments get tight as well. So moving that shoulder back to its normal range, it's not pain-free.
Okay.
It's not, and it's not often a pleasant experience. I try to, now I do encounter many patients who have been to other physical therapy clinics and they say, oh, they made me cry in there. And an experience of physical therapy should not be that painful. It shouldn't be the type where you just absolutely dread going in there. I hate physical therapy. That's not the way it should be. But I'm not going to sit here and tell you that it's entirely pain-free.
Okay. Well, my son had physical therapy once, and he said it was painful at first.
I'm not sure I would trust him.
Okay, but at the end, at the end, he said it was worth it because his pain was gone.
Exactly, and he's probably swimming better and faster.
That's right.
Yeah, so oftentimes the pain is worth it. You know, it's like any experience where you're changing, like a spiritual experience where you change.
That's
there
right.
There can be some mental, emotional pain you go through, but you come out better in the end.
So you would agree with the statement, no pain, no gain?
Kind of.
Okay. Have you ever had anyone that didn't cause more pain when you started working with it?
Absolutely.
Okay.
Absolutely.
Okay.
In fact, I have several a week.
Okay.
Where, it just quick fix and it's, their pain's 80% better.
Good, good. Well, that's good. So, some people have pain, some people don't, but the bottom line is eventually the pain will go away. And I'd rather have a person get at the cause of pain than be stuck on a narcotic or something. And a lot of people are stuck on pain medicines, and before long, it's not their choice. They become addicted.
Correct.
And then they don't know what the problem is, and then it goes on, and then it creates one problem after another.
That's right.
Now, we have had a lot of questions come into our website regarding posture. Okay, could you give our audiences some tips, some posture? We have a lot of people that watch our program that drive trucks. We have a lot of people that sit down and watch television. Give us some basic ideas about posture, and what are some things that we might do to work on posture, or know that we're not having good posture?
Well, one of the things that I see a lot of in my office are the results of a slump sitting posture.
Okay.
Someone who's at a desk job, 8-10 hours a day, they'll invariably start slouching in their seat. That makes their shoulders girdle around forward, their head goes forward, and instead of sitting up tall and weight bearing on the pelvic girdle and the spine being in its God-given, God-designed alignment,
okay,
and the head being balanced over the rib cage, everything is out of kilter. And it's a lot, it's simple physics. It's a lot easier to hold a bowling ball here than it is out here.
Right.
Okay. I just saw a study a couple months ago that suggested that for every 1 inch that the head is forward of the rib cage is a relative doubling of the weight of the head, as far as the muscles and soft tissues are concerned. Wow. So that 13-pound bowling ball you have here now, if it's forward an inch, it's now 26 pounds. Now it's 30-something. So a slump sitting posture is very destructive.
Okay.
And there's a really fairly quick remedy to it. I mean, if you're involved in a job that has a lot of sitting, like you're a long haul truck driver, or you have a desk job, or you're on the phone at a call center, roll up a towel,
okay,
4 to 6 inches in diameter, and put it in the arch of your back. Okay. And just give yourself a physical barrier back there that will it'll prompt you to sit up taller.
Okay.
Also, having your chair height above the level of your hips will help prevent you from slumping down. If the seat's too low, the physics of it tends to make you want to slouch.
Right. Well, those are some great suggestions, because, in this new healthcare world that we're going into, I would dare say that I would recommend sending to a chiropractor, and I'm going to tell the reason right after this break. So stay with us. Our correct number is 855-644-3278. You're watching Heart of Health Live.
The Heart of Health Live will return in just a moment.
There's a place for modern medicine, but that's not enough. There's a place for lifestyle, but that's not enough. The real truth in medicine, the real truth in healing comes from that relationship with the Heavenly Father. That relationship can show us the balance. When to use modern medicine, when to use lifestyle, and to use it for the right reasons. Well, this book gives the solution to the healthcare dilemma. It answers the question, why am I sick? How do I get better? And how can I have ultimate healing? I'm Dr. James Marcum, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back to Heart of Health Live. We're talking today to physical therapist Russell Atkins. He worked with patients with a variety of problems we talked about earlier. And if you've had sports injuries, you're fatigued, or pains in the lower back or whatever, having mobility problems. Last section we talked a little bit about posture. Russell gave us some great ideas about, I didn't know that about the head going forward. So I guess if someone says I have the big head, they mean this, and they don't mean this. But that's very interesting, because I think in designing this new healthcare reform, if I were to want to cut money a lot, I would have people go to a physical therapist before they had a problem. Because I can't tell you how much money I spend ruling out chest pain, atypical chest pain, because people just have bad posture. Mm-hmm. And the way our system is, you send it to a cardiologist with chest pain, that 99% chance they don't have it. It's because they're sitting wrong, or, right. I have chest pain. Well, you walk like this all the time, no doubt about it. But you can't say that. So you put them on a treadmill test. It's all normal. And then you send them out, and guess what? If someone doesn't address the problem, they're going to come back next week with more chest pain, and everyone's not worried about that your posture killing you right away. They're really about your heart. So they send you back to cardiologist and say, listen, there's a 1% chance of stress test, not, let's go to the next test. Yeah. So I think that, wouldn't it be fun if someone came to you and say, listen, I don't have any problems now. Can you look at the way I walk, the way I sit, the way I'm adjusted, and see if there's any suggestions you might make to make me feel better?
Well, I rarely get a patient like that, maybe 1 in 200. And it's more common to get someone whom I've treated for a certain problem, and then they'll intervene and say, hey, what can I do to prevent this from coming back? But occasionally, even in the last month, I've gotten a couple of guys that are weightlifters, yeah. And they're not having any shoulder or back issues, and they don't want any.
Right.
So they've paid for a couple of consult visits out of their pocket for me to advise them on ways to lift weights, ways to exercise, ways to stretch, so that they stack the deck in their favor, so they don't create a problem.
Now that brings me up, everyone wants to talk about money, and our audiences are interested in money too, how much healthcare costs. And if you think of it this way, if you take a hydrocodone, a naproxen, and a soma, mm-hmm. That could be a couple $100 a month.
Easily.
And if you spread that over a year or 2 years, that's a lot of money. So it might be better off for someone to say, listen, I'm going to spend some money on a visit to maybe fix the problem, even if insurance doesn't pay. Now, does insurance typically pay for preventive care?
No, they don't.
No,
sadly, it doesn't.
Yeah.
And it's, my understanding is kind of a Western hemisphere mindset. The Eastern cultures will tend to gravitate more toward prevention, whereas the Western culture, okay, it's broken now. What do we do to fix it, or what do we do to cover it up?
Yeah, that's a good point. I've always been interested in how, when people touch people, there's something goes on in the brain, mm-hmm. that your body makes the natural painkiller, the endorphins.
Right.
Also turns off your stress chemistry and inflammation just when someone touches you.
Yeah.
Also, when you can manipulate muscles away from nerves and get things directed in their proper place, the physiology gets better.
Sure.
Now, what do you think about hydration and muscles? That comes up all the time, hydration.
Well, certainly our bodies are, 80-some% water?
Yeah.
And, I just read another study that suggested that a majority, 80% of the joint aches that we deal with are a result of a lack of water. Mm-hmm. Same thing with headaches. Mm-hmm. The discs, the little intervertebral discs in between the spine, which God gave us for shock absorption, they're mostly water. I think hydration is clearly important, and I think there's nothing better than good old water.
Right.
There's some things coming out now that suggesting these sports drinks are doing more harm than they are good because all the sugar that's in them and high fructose corn syrup.
Well, I like to hear that because, when I think of a problem, I think of the way God made us. And there's certain components that we must have, the fuel for it to run correctly. And then if we're not moving it in the correct directions or get it contorted, then that adds to it. So it's sort of a multifaceted thing.
No question.
I'm just really ashamed of what we've turned medicine into sometime, and I think, for instance, I think everybody that undergoes any type of orthopedic surgery benefits from having orthopedic care afterwards.
I would tend to agree with that.
At least for a little while.
There are some orthopedic surgeries that people generally do fine without my help.
Okay.
But for the most part, I think that I have something to offer anyone that comes out of an orthopedic surgery.
Well, after break, we're going to go to a question for our website about what happens if physical therapy doesn't fix the problem. You still have time to give us a call at 855-644-3278. And don't worry, Russell Atkins is going to be back with us again if you're too shy to call tonight. So go to our website, heartwiseministries.org. We're going to be right back after these short breaks.
Heart of Health Live will return in just a moment.
Have you ever heard things about God that didn't make sense? Have you ever thought that science and Scripture cannot be reconciled? Have you heard ideas about God that scare you? Or are you just tired and confused? If you want answers to complex problems, if you want a testable, evidence-based understanding of God and the world around you, an understanding in which the Bible and science harmonize to reveal the reality that God is love all the time, then Come and Reason Ministries is for you. Hi, I'm Dr. Tim Jennings, board-certified psychiatrist, and Come and Reason Ministries is dedicated to helping you learn to discern, to stimulate you to think, to help hone and refine your ability to know the right from the wrong, the healthy from the unhealthy, and teach you how to experience healing of your mind, body, and relationships here and now. If you would like an evidence-based approach to knowing God, then visit us online at comeandreason.com.
Imagine a classroom with no boundaries. A classroom where reenacting a book is an English class, and repairing a motor is a math lesson. A classroom where caring for horses is biology. This is our classroom. At Bachman Academy, 6th to 12th graders with ADHD, dyslexia, and other language-based learning differences are provided a language-rich, hands-on program of study. With an average of 5 students per teacher, Bachman students receive more attention and have more time to learn while using their own learning strengths. Now, imagine your child in this classroom. To learn more about Bachman Academy, visit our website at www.bachmanacademy.org. Bachman Academy, tapping potential one person at a time.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back to Heart of Health Live. You still have a chance to give us, Russell, some questions tonight, 855-644-3278. Our next question comes to us and it says, what happens if physical therapy doesn't fix 100% of my problems? So what happens if physical therapy doesn't fix 100% of my problems? What do we do?
Well, to start with, assuming that a patient came in because something hurts, if their pain is mechanical in nature,
okay,
then a good orthopedic physical therapist has a chance of certainly improving those symptoms, and if not, then completely resolving them. Now, I routinely discharge patients who still have pain symptoms. You know, I try to educate my patients on the body's healing process, and we don't heal overnight.
No.
Sadly, we don't heal instantly from a wish. And it takes time. It can take 8, 10, 12, 16, 24 weeks. It can take months to completely heal. And I will routinely run into patients out at a dinner or at church or somewhere out in the community, and they'll tell me, hey, I kept doing the exercise routine you gave me to do, and I woke up one morning and my whatever quit hurting.
Yeah.
So, healing has occurred.
Right. But how do you, so healing occurs when I guess the pain gets better every day and doesn't get worse?
Yes. First of all, that the pain was mechanical in nature.
Right.
You see, pain can be emotional, pain can be chemical, it can be a chemical imbalance. It could be it could be one of those 200 diagnoses for low back pain symptoms that's not therapy appropriate. And again, that's why, if it's 6 to 8 weeks, a patient is not trending toward improvement, it's time to investigate elsewhere. One of my mentors said that says that therapy. Let's see. It says treatment rendered with greater enthusiasm or greater frequency. Ineffective treatment rendered with greater frequency or greater enthusiasm remains ineffective.
Yeah.
So why would you keep rendering ineffective treatment if it's not getting someone better? Move on.
Well, that brings me up to another issue that I'm sure a lot of people are struggling with, is that nowadays, it seems like we don't, as clinicians, we don't have time to spend with patients. They're giving us 5 or 10 minutes, and how much can you really accomplish? You don't really accomplish anything.
Right.
What's wrong with our system, Russell? Why are we so broken? Everyone has their opinions.
Well, the short answer is that humanity has deviated from the original design, from creation. Health is governed by laws. Mm-hmm. If you eat more calories than you burn, you're going to gain weight.
Right.
If you smoke 2 packs of cigarettes a day, the inner lining of your blood vessel is going to roughen and plaque's going to stick to it. Mm-hmm. These are laws, and if you violate those laws, you do so at your peril. And if we learn the laws, and I think everyone should dedicate a certain amount of time to educating themselves on the laws of health.
Right.
Then you can begin living in conformity with those laws, and it's the better design. It's the way we were designed. It's like a car manufacturer. You don't put diesel fuel in a gas engine.
Yeah, well,
it's going to be a problem.
That's well said. Because think about it. We were never really designed to sit in chairs.
Correct.
The earth wasn't created with chairs. We weren't necessarily designed to sleep in beds. And I know that chairs can cause musculoskeletal problems. Beds can cause musculoskeletal problems. We were never designed to ride in cars everywhere.
Right.
So those could be considered violating natural laws. And now we see we do have problems.
Yep.
And unfortunately, the problems require us to seek help. Mm-hmm. And I think that's the key. Where do we go to seek help? And that's what we try to go. We try to focus here. We want people to go to the ultimate physician to seek help first, and then hopefully he will lead them to the laws of health, like you said, and then the appropriate use of modern medicine. Now tell me, have you ever seen a patient in the office that you said, I know this is not musculoskeletal, and said, listen, I know I can't help you, go somewhere else?
Oh, absolutely. Absolutely. I see it, sadly, too frequently.
And I think that's the ultimate compliment to any provider, to say, listen, this is something that I can't handle. I'm moving on here because I think your problem is not musculoskeletal, it's this, or this.
Right.
I see too many people continue to try to fix something that's not broken. Now, several times I've been tempted with people with chest pain that I know it's not their heart to send them to a physical therapist. But sometimes I know a lot of it just because we have so much stress in our body, it just puts a lot of stress on the muscles and pains. And once you tell them that your heart's okay, sometimes that helps enough stress to go away.
That's right.
So we have a couple more breaks before you go, but if you have one last question, give us a call at 855-644-3278. And we're so happy to be learning about the body, muscles, physical therapy. Russell has been teaching us ways we can change our chemistry. He's healing people with his hands and his knowledge rather than with pills and fixing lots of ills. We'll be right back after this short break on Heart of Health Live.
Heart of Health Live will return in just a moment.
I'm Dr. James Marcum, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org.
Have you ever heard things about God that didn't make sense? Have you ever thought that science and Scripture cannot be reconciled? Have you heard ideas about God that scare you? Or are you just tired and confused? If you want answers to complex problems, if you want a testable, evidence-based understanding of God and the world around you, an understanding in which the Bible and science harmonize to reveal the reality that God is love all the time, then Come and Reason Ministries is for you. Hi, I'm Dr. Tim Jennings, board-certified psychiatrist, and Come and Reason Ministries is dedicated to helping you learn to discern, to stimulate you to think, to help hone and refine your ability to know the right from the wrong, the healthy from the unhealthy, and teach you how to experience healing of your mind, body, and relationships here and now. If you would like an evidence-based approach to knowing God, then visit us online at comeandreason.com.
Hello, I'm Joe Coaches. If you enjoy Heartwise Ministry as much as I do, you just might want to become involved. We would first really appreciate your prayer that God would continue to bless and lead this unique ministry. Also, it is very important that you think about becoming a financial partner supporting us so that we can take this message throughout the world to everyone. Thank you.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Well, thank you for joining us today on Heart of Health Live. Russell, we want to thank you for being with us.
Pleasure.
And I want to get you to do some of these voiceovers here too, because you have a great voice for radio and TV.
I have a voice for radio and a face for radio.
Well, good.
So I've heard.
But listen, and audience, if you're there and have more questions about physical therapy, I think we've learned a lot of basics. We've learned that physical therapy is important. It's a way to change your chemistry. We want to get at the cause and not treat symptoms. We want to address problems before they become big problems. We've learned a lot today, and we're going to continue to learn. We want our audience to go in and ask questions, and I will group them together and have Russell have them, and I'll even send them over to you beforehand so we can get some real good answers, because we want to help you out. We want you to feel better. We want you not to have to go to a doctor and have back surgery and lots of pain medicines. And there's so many people out there that if they do just a little bit now, you're going to prevent lots of problems. So we want to remind you all, go to our website, heartwiseministries.org, and someday Russell might even write an article that we'll post up there about back health. Thanks for joining us. Join us next time on Heart of Health. I'm Dr. James Marcum, signing off with Russell Atkins.